Okay, so now that we have talked about IV insertion and all those pieces, I'm going to go through just the motions of actually inserting the IV, and then I'll also play a video that goes from start to finish with the determining the need for the IV, identify your patient, going through the hand hygiene and all that. But right now I'm just going to go through the actual physical motions of it. Okay, so I'm going to make sure I have all my supplies ready. First up, I've got my IV start kit. So inside of here, we've got our tourniquet. So I'll go ahead and take my rubber band off of that. Lay that right there. We've got our tape that is stuck to this gauze pad. I'm going to leave it inside the gauze pad, or inside of this little package, because it was sterile inside here. So I want that gauze pad to stay pretty clean as I can keep it here. So I've got my tape. So whenever you get your tape ready and prepped to do your IV, a lot of times you're going to see nurses stick the tape to the bedside table or to the side of the bed, but we want to create a fairly clean space for our tape to be. So what we'll do is we'll take this piece of tape I just pulled off of my clean roll, and I'm going to put it against the side of my table here, and that's going to provide me a clean surface for where to put my tape. Now, as far as how you pull off your tape and how you position it, a lot of people have different opinions for that and have their own way about it, and you will also have your own way. I like to get this transport tape and pull it into two little pieces, so that I'll put that over here on my edge, just so it's dangling off the side, but it's on my clean tape. And then I do one big piece also. Okay, so I've got my two little pieces of tape and my one big piece. The other thing I've got in here is my clear transparent dressing to put on top of the site when I'm finished. So the other things that we need are going to be a saline flush syringe, our pigtail 7-inch extension tubing for the IV, so the short extension tubing. In the hospital setting, that's going to come in one of these sterile packages, just like this IV start kit was. So I've got that. And I've got my needles. I've got two different sizes. I brought with me a 20 gauge and a 22 gauge. Pink 20, 22 blue. The other one you see most commonly is green, which is 18. Okay, so now I'm ready to find my vein. I've got all of my supplies. So I'm going to turn this arm over so that I'm looking at the back of the hand. So remember, we want to start distally, because if we have something happen and we use this big giant vein right here that looks so good, this one looks so good, and a lot of times you see that the vein that they're using this antecubital space for the IV, or an AC as what that's typically called, because it's such a big vein. And what happens is they come in an emergency, they just are getting that IV in and getting it started. But we're up on the floor and we want to take it out of there. It's been there for a couple days. But if this had infiltrated, we wouldn't be able to use any of these veins below it, because if this vein wasn't patent and it's leaking out, there's a hole in it, it's leaking out into the subcutaneous tissue here, and then I started an IV right here, what's going to happen when I run those fluids? It's going to get to that point and just saturate out. So we do want to start distally, as I said. So we're going to look at this hand here. So there's multiple veins in the hand. You just need to find one that's long enough to support your catheter line. So we've got one here. Typically, they're gonna like run kind of between your fingers. And so I would probably use this one here because it's big, it's about this long, so it would hold my catheter tip and it's good. But for my teaching purposes today, I'm actually gonna go a little bit more proximally. And the reason for that is because because with our setup here, with our artificial limb, we won't get blood return if we go into one of those hand veins. So I just want to get blood return so that I can show you guys what that looks like. So I'm gonna go with this big vein right here so that we can get blood return back. So I'm gonna use a 20 gauge catheter. I could probably also use an 18 gauge because it's a pretty large vein. If I was going for this one in the hand, I would probably use a 20 or 22 because it's a little smaller. But you also want to think about why you're starting an IV. So that's going to also impact how what size you are going to use. So we still have some setup to do, but I like to go ahead and clean that vein first. So this is a chlorheptic sponge here. You squeeze it, it clicks, and you'll see the chlorhexidine, the cleaning agent, come out. So we're going to clean this area really good in a circular motion inside to out. So we've got it good and clean. You can also use alcohol swabs if you don't have chlorhexidine, but best practice says chlorhexidine. So that's what we're going to use. It does take a while to dry. We want it to air dry. We're not going to sit here and fan it and blow on it and get all our germs all over it. We're going to let it air dry. So that's a good time to start setting up the rest of your stuff. So other things that we want to set up. We've got our saline syringe and our IV extension. If you have just opened this up out of a sterile package, then this tip of this is sterile. If you have not touched it, it is sterile. If you are not sure if you've touched it, then you clean it. Or if it's just been laying out on the bed like this, then you're gonna clean it. So when we scrub the hub, is what we talk about when we administer IV medications or hook anything up that's gonna be going intravenously. We want to scrub the hub. So not a courtesy swipe. We want to get our alcohol swab on there and scrub for 15 seconds and get it good and clean. Because remember, this is creating a direct route into the patient's veins and into the bloodstream, so we certainly don't want to introduce any bacteria. So we're going to use an aseptic technique. Pull off the cap of our saline syringe, get the air out of it. I just gently squeeze the air, that fluid up to the top to get the air out. Then use an aseptic technique so that these aren't touching anything else. Attach that saline syringe onto your IV catheter. We're then going to flush that catheter so that it's got saline in it, because we don't want to hook it up to our patient and it have air in it and then push that air in. So we'll flush it with saline. This cap that's on here can stay on. See, you can just push right through it. It'll keep on dripping past it. All right. So our site is good and dry now. And you may usually to find your IV site, you will for a person. I've got this nice, lovely mannequin arm that has beautiful large veins for me to be able to see with little difficulty, right? But with humans, sometimes they're harder to see. So before you clean that skin and pick your site, you will have already tightened this, this up to find the best spot. So let's talk about how to tie the tourniquet, because I mean, I'm gonna be honest, a lot of starting IVs, what makes it difficult is your finger is getting the muscle memory and the hand coordination down. So when you are tying your tourniquet, you do not tie it in a knot because you are not gonna be able to get that off very fast. we do a quick release tie. So to do that, you will cross in front of you from right to left, so that the one that you're holding with your right hand is facing you over top of the other, okay? So then pull it tight. I usually use my left hand as an anchor. So I hold this other one tight, pull with my right hand tight, then I use my thumb to hold that cross there tight so that it doesn't get loose. And then using my right hand, just tuck, let me turn it so you can see, tuck this end underneath, okay? So that's going to give me two benefits of my tie. One thing is going to be that it is a quick release tie. So when I get down to where I am done sticking the IV in, and I want to get this tourniquet off, I can just pop that right off. The other benefit, I'm going to go ahead and tie that again real quick. The other benefit is going to be that these strings, the reason I tie it in that direction is so now these strings are up. They're out of my way. If I went the opposite direction and had the other string in front and tucked it this way, those strings would be hanging down right where I'm trying to start my IV and being right in my way where I couldn't see. So we don't want that either. Okay, so now tourniquet is in place. We have a clean IV site. We've got our tape ready. We've got our tubing ready. We've got a dressing over here ready. So next up, we'll pull out our IV catheter. So quickly, let's talk about these catheters. All of the needles that you'll use to start an IV are all going to have a safety release mechanism. So you need to be familiar with that before you get started. So for this particular needle, the safety release mechanism is this little slidey thing right here. It's going to slide up, and when I push it all the way over the needle, it'll click into place. So that is this slide. That is the safety mechanism for this particular needle. Let me grab another needle really quick so I can show you a different one. Okay, so here is a different kind, and never mind, the same one, sorry. Okay, here we go. Now I have the right one. Okay, so here's another kind of, this is what I believe they have at Iredale. It has this button here. So with this one, after you advance your catheter over there, you would push this white button and it retracts the needle. So be familiar with what type of needle securement device you have before you get in there, because you don't want to get yourself into trouble not knowing what to do after you've got that needle in. Okay, so we have our IV catheter here. Whenever they manufacture these, the plastic part kind of sticks to the needle. So I like to hold it. You don't want to touch anywhere up here aside from a risk of a needle stick. Also, that is the portion that's going into the patient's skin. But right here closest to the plastic, just where the color is, if you hold it and spin it, you can feel that tension release. So that way it doesn't cause you trouble whenever you get in there and you're trying to get it off and you end up dislodging it. The other thing, I'm going to just get this needle as close as I can and be able to see it. There we go. So you see the bevel is that where the hole is. It's on an angle. Here's the back side, and then it's sideways. So the bevel is where that hole is, right in the middle. So we want bevel up whenever you start your IV. You do not hold the skin like this, okay? You don't hold it. Why? Because I'm probably going to stab myself in the hand, right? Are you all freaking out at home because it looks like I'm going to stab myself? Okay, so don't do that. You can hold underneath the arm to anchor the skin, because you do want to anchor the skin so it's tight. You can also pull tight from behind it and go like over your thumb if you're pulling down like this. But you do not anchor it from directly in front of where you're sticking, because that's going to put you at high risk for a needle stick. Okay, so now we're ready to stick. So we're going to go in at a fairly flat angle here and bevel up. You'll be able to see that hole, and go right into the skin. I hold this, the way I hold it is just like I am. I hold with my middle finger and my thumb and hold my index finger over top, and then just slowly insert. When you enter the vein, you will get two things. You'll feel it kind of pop a little bit, and then you'll also get blood return. I don't know if you can see that, where this is red. Yeah, you can. So see how this got red inside of it? So I got blood returning back into my IV catheter. That tells me I'm in the right spot in the vein. Now, if I just go ahead and thread this, I'm probably gonna end up infiltrating it. You have to advance a little bit further into the vein at a good flat angle. So, and then we want to thread that plastic piece, thread it over top, because right now we've got that metal needle stuck inside and the plastic sheath over top of it, which is what we're going to leave in there. So we have to thread that through, because we don't want to push the needle too far or we're going to go through the vein. So we want to thread that through. So with this particular type of IV device, we're going to use our thumb and index finger as anchors and use or thumb and middle finger as anchors, and then I'm going to use my index finger to slide that over. Okay, so that until it gets all the way to the skin, till that pink or colored part is touching the skin. So you just anchor this backhand still. You don't slide that needle in and out, okay? You just slide just the catheter over top of that needle, or you're gonna push the needle all the way through. Then for this one, then we can engage our safety. And you heard that click. So that needle is now safely embedded in this hard plastic, so I can't stick myself. So we've got our IV in. Now it is time to get everything taped down and prepared. So first thing we're gonna do is pop that tourniquet. If you do not pop that tourniquet, you are gonna make a huge mess, and you will do that at some point. Everybody does, it's okay. But we're gonna pop that tourniquet, because if you do not, when you pull this off, you are gonna have blood flowing everywhere. I always take a towel in with me and lay it under the patient's arm anyway, because I tend to make a little bit of a mess. Okay, so now what we are gonna aim to do, we're anchoring. So I'm holding on to this the whole time. I don't wanna let it go, because I don't wanna lose that IV I've just worked so hard for, or put my patient through another needle stick, more importantly. So we've got our anchor there. So we want to get it hooked up and flush it out. So I'm going to take this cap off, okay, and it is getting, like I said, a lot of it is getting that muscle memory down. Okay, so I'm going to try to shift this. So this needle, the plastic part that's in the skin, is probably going about to here. So I'm going to put some pressure above the IV site to kind of block that blood flow, so that when I pull this off with these fingers, I'm blocking pressure with my middle finger, so that when I pull this off, it's not going to spray blood everywhere. See, it's still going to drip a little bit. We're still getting a little bit of drippage, but I'm going to show you it, but it will drip everywhere if you take that middle finger off. So I'm just going to screw that on. See, I made a little bit of a mess, and that's okay. So I've got this screwed on. So next thing I'm going to do is I'm going to pull back to see if I've got blood return. There it goes. See, I got blood return coming up through that catheter, so that means my IV is in the right spot, and then I'm going to flush it out with this 10 cc syringe. Okay, next up is securing it. So one thing, having this whole big syringe attached here and flopping around is going to be kind of hard. So I'm going to flush that a little bit. And then I'm going to disconnect it. I'm getting blood back in here, but that has to do with the mannequin. A person won't do that. They might a little bit, but not that bad. Okay, so now it is time for me to secure this. So this whole time, I've not touched this site right at where it enters the skin. I'm going to use my gauze and clean up my mess a little bit so that the skin is dry. I'm going to make sure that this is twisted on really tight. I'm going to clean the skin so that everything's dry. And so now I'm going to use my tape. So different people have different things they like to do. I like to butterfly my tape. So I put this tape on upside down, and then I use it and make a cross up here, across like this, to anchor that down. So now I've got a secured IV site. It makes like a little X. Now I'm going to use my transparent dressing. So my transparent dressing, I'm going to go just to here so that I can get to this hub if I need to, so that I can change out that. So I could change just this tube if I needed to, without having to remove the IV. So I'm going to put that transparent dressing just over the edge there. Okay, I'm going to pull this off. Okay, got my other piece of tape here. I like to put it here to secure, and then my big piece of tape I will use to secure the whole thing. Okay, and then our last step here is going to be on your tegaderm, you've got this little piece here. So on there, you can write the date, time, and initial. Okay, I'm going to bear down on a table, not on my patient's arm while I do that. And then I'm going to stick this on top of this dressing, but not where it's blocking my IV site. So now I can see the entrance site so that I can observe for any redness or swelling or drainage there at the IV site.